Good morning. Thanks to each and every one of you for joining us here on what I guess before it's over will be one of the hottest days of the year. And we appreciate your taking the time to come out for a very important announcement today. I stand here at the United States District Courthouse, the federal courthouse, named after a man I revered, named after a man with whom I attended church for the first 40-something years of my life. Named after a man who all of us in Cape Girardeau, Greater Cape Girardeau, Southeast Missouri revered because he symbolized devotion to the Constitution, devotion to the law, the disciplined study of the law, and teaching it as well to generations who came after him. Mr. Rush, as we called him, until his death 14 years ago, was a man who exemplified everything that we all want to be in our lives: good citizens and devotion to the Constitution. And it is that idea and those principles that we're here to vindicate today. Thomas Jefferson and the other founders, and Jefferson said, "Trust no one, we bind office holders down with the chains of the Constitution." And that is what today's effort is about. So this morning, I am joined by 3 other Missourians in filing a constitutional challenge to protect our freedoms, to make our own health care choices, and to protect the right of every Missourian to direct our own health care choices. Now, all will remember that during the protracted health care debate of most of a year, the President promised, quote, "If you like your health care plan, you can keep it." He said that. If he said it once, he said it 5,000 times. The 3 Missourians who join me as plaintiffs in this case, and who I will introduce shortly, will all lose the options for health care insurance they currently enjoy. We are bringing a case, a constitutional challenge specific to Missouri and to Missourians. The circumstances we face as Missourians in our daily lives and the negative effects this bill will have on these plaintiffs and our neighbors and all Missourians. My goal is not simply to set aside or repeal this law, but to give the Congress the opportunity to replace it with a real health care reform law. Now, as I told you earlier, I'm joined by 3 other Missourians, and I would like to introduce them and share with you their stories this morning. One of them has joined me this morning with her family, Julie Keithley of Dexter, Missouri. Julie is a longtime friend of mine from a well-known Missouri family. Her late husband, Mike Keithley, was a friend I met in Boy Scouts 41 years ago, and who later became, at my request, an official in Jefferson City, first running the Missouri Senate administration and then going on to be essentially the chief operating officer of state government under Governor Blunt, as commissioner of the Office of Administration. Tragically, we lost Mike 2 years and a few months ago to cancer, and Julie is here today with her 2 sons. Now, Julie joins me. Before Mike died, they adopted these 2 fine boys you see with me, Peyton, the older one, and Mason. Julie joins me in this legal challenge on behalf of her son, Mason Keithley. Mason is 8 years old and suffers from the autism spectrum disorder. During this year's legislative session, Missouri lawmakers from both parties worked tirelessly to pass into law legislation to help Missouri families with insurance coverage for autism-related health care costs, and a big step forward for Missouri in our fight to help families affected by autism. However, because the new federal law because Missouri now requires insurance companies to provide coverage of autism-related treatments, and because this coverage is more than the coverage mandated in the federal law, Missouri will be required to pay a penalty to the federal government because the federal health care law does not cover these services. In other words, because Missouri requires more health care coverage than the federal law, Washington will impose a direct tax upon the citizens of Missouri that you've not been told about in this law. Julie has joined this suit to ensure that Missouri and Missouri families will not be punished and taxed by the feds just because they require more generous benefits for treatment of autism than Harry Reid and Nancy Pelosi would see fit. The next plaintiff joining me in the lawsuit today, unlike Julie, could not make it. She is 75 years of age, residing in St. Louis. Her name is Dale Morris. Dale Morris is a Missouri senior living in St. Louis County, and she suffers from several serious medical conditions, including 2 heart attacks, a survivor of colon cancer, congestive heart failure, and so on. As a result of these conditions, she has received quadruple bypass surgery and requires constant medical care and prescription medicines. Dale is retired and living on her sole source of income of Social Security. For decades in her working life, Dale paid into the federal Medicare system, and that now is the means by which she obtains her health care coverage. Dale, like thousands of other Missourians, is eligible for Medicare Part C or Medicare Advantage, a good program. This plan provides supplemental coverage for Dale's health care and allows her to receive health care she would not otherwise receive. In the new federal health care law, Medicare Advantage will be reduced or eliminated for most Americans by eliminating the Medicare Advantage Stabilization Fund. You see, citizens of 49 other states, including us, are out. But if you lived in certain zip codes in Florida, you get to keep it. This is the special deal we have now come to know, by virtue of the state, as Gator Aid. It is neither fair nor constitutional to deny Dale Morris and seniors similarly situated medical coverage while allowing similarly situated citizens in Florida to keep their coverage in order to buy off the vote of one senator in a corrupt bargain. Now, the final plaintiff, who also could not join us here today, joining me in the lawsuit, is Samantha Hill. Samantha Hill resides in western Missouri, and she is a young lady, 21 years of age, recent college graduate. She neither smokes nor drinks. She is unmarried with no children. Like many young, healthy Missourians, Samantha has the ability to pay for her own routine medical expenses, but being healthy and 21, she has made a rational decision for her, as many in that age cohort have, to have an insurance plan that will pay for any major medical or catastrophic medical expenses and routine expenses out of her own pocket. Samantha does not need, nor does she desire to purchase, a federally mandated, bureaucratic design, one-size-fits-all, big government plan that covers smoking cessation and substance abuse, among other provisions she doesn't need. Even though Samantha stays active, exercises, and is healthy under this new federal law, she is forced to purchase health insurance she neither needs nor wants. As you can see, the stories of Julie and Mason, Dale and Samantha are similar to many of our neighbors here in Missouri, and we may be adding other plaintiffs as this lawsuit progresses. These are stories that show exactly how this health care law is negatively affecting individual Missourians in the way they live their lives every day and every week and every month. These Missourians show how this law has actually shrunk, reduced the available health care coverage and made health care more expensive while it reduces the quality. We are bringing a constitutional challenge that represents the freedoms we share and freedoms we cherish here in our great state of Missouri. While some states are filing similar challenges, ours most clearly defines the values we hold dear here in the great state of Missouri. The primary election is 4 weeks from yesterday, August 3rd. Very important day, not just because we're selecting party nominees in both parties, but for a reason of the measure that is on your ballot on the health care issue. The Health Care Freedom Act says we Missourians will direct our own health care choices, and thanks but no thanks to the federal government. So Missouri is ground zero. The next 4 weeks from yesterday, Missouri is ground zero with Prop C, the Missouri Health Care Freedom Act, on your ballot.